Welcome. This is the training video for the Kangaroo Joey pump. The first thing about this pump is it does not require batteries to be installed in the pump. It has an internal rechargeable battery, so there's no batteries to change. You basically plug it into the wall to charge it up and then unplug it and take it around with you if you need to go somewhere. It's a relatively small mobile pump that you can put into a backpack and then be taken around with you while you're out and about. So I want to show you the two accessories to it. So the first two accessories, this is the AC adapter, the part that plugs into the wall. So that basically plugs into the pump back here in the back, a little receptacle right here. Simply plugs in like so, very easy. So at that point you can plug it in and have charging while you're at home, charging at night while it's not being used. You can unplug it and use it during the day. So it plugs in, unplugs, very easy. Second accessory I'd like to show you is the pole clamp. So this pump can also be used to be mounted onto an IV pole. The two parts of this is that this wheel untwists and you can basically loosen this up. This is where the IV pole would go. So you put this on the IV pole like such and then tighten it down. The other part goes onto the back of the pump. So to install in the back of the pump, this little receptacle goes into each other. Very easily like that. And then you tighten it down. So I'm gonna hold it so you can get a good look at that. So then now you tighten it down with this little wheel over here. I'm gonna get a good angle on that. This wheel right here. So I'm gonna go ahead and righty-tighty to tighten it. And that is now getting tight and a little extra twist. That is now secured and tight. So at this point you can then secure this to an IV pole like this. Just like so, and it'll hang onto the IV pole and sit like that. So you can use either on an IV pole or on a backpack. So go ahead and take this off for the rest of the demonstration. And if you're not using it on an IV pole, you can take this piece off, set it somewhere aside. Make sure you don't lose this. When we get the pump back, we'd like to get all the accessories back with it. This is something very small, easy to get lost. Please do not lose this. So I'm going to set this to the side. So the next part I want to go over is the tubing, loading and installing the tubing before we turn on the pump and get into it. So the next part is the tubing. So I have here a Kangaroo Joey pump set, a 1,000 milliliter. We have two sizes, a 500 and a 1,000. For this one I'll be using the 1,000. So I'm going to go ahead and just open this up. Discard the trash. Discard the trash. Have a little card here that you can put some additional information. This is a little sticker, so you can stick it onto something, patient name, room number, date and time, their formula, volume per day, any additional information that they would need. So go ahead and set this to the side. So the bag, we'll look at loading formula into the bag in a moment. First what I'm going to do is go ahead and install the tubing into the pump to show you how that works. One more piece of plastic to remove. All right, so this is the tubing. This is the portion that goes into the pump right here. So in order to install this into the pump, it's very simple. The lid of the pump lifts up. There is no real latch that's holding it down that you have to really remove. I'm just basically pushing up on it, and when I push up on it, it lifts up. Basically, this little portion right here is what's holding it into place. There's a little bit of a lip that it's falling into right there. So you just simply lift it up and it lifts up. It has a little diagram right here that shows you how this install happens. I'm going to show you as well. So basically you want to hold this by what I call is a little handle. It's got a little handle here. Hold it by the handle. Handle goes into this section right here, and you just want to give it a little push in there. So it's, set it in there, give it a little slide in there, help the tubing go through this channel right here. That's the first portion of it, very easy. Next portion of it is to wrap it around this wheel right here. So wrapping it around the wheel, 1, 2, and then the third portion is it goes in this little groove right here. And that just slides into place. There's no real snap or click. It just sets into place. Another angle on that so you can look at it. It just falls into place like so. And that's how you put the tubing in. Really no wrong way to do it. If you try to put in this part upside down, it is not going to work. You're going to see right away that it doesn't really slide in there. There's no real securement that happens. So it needs to go in the one way. Sideways, it still is not going in there. There's no wrong way to put this thing in here basically. So hold it by the little handle, slide it into place, help the tubing out through that channel, around the wheel, and into the other channel. And it holds into place just like so. At that point you can close the lid. At this point you can see here the tubing is pretty free and clear. There's not much pinching that the lid can do. Even if it slides all the way over to here, there's still enough of a groove, of a gap, that it will not also pinch the tubing. So there's pretty much no way that the lid will pinch the tubing. So we got the tubing installed. Next thing I want to look at is on the patient side of the tubing. So we opened up a brand new tubing. Comes with this little white cap. This little white cap's just to, just a protective piece for shipping purposes. So you want to take this and remove this. You can toss that. The next part here I want to show you here is this is the part that actually connects into the G-tube. So what's going on is there are two pieces here, the white and the purple. Currently the G-tubes are designed to have this basically just insert into the G-tube. What's going to be happening is at some point the G-tubes are going to be changing over to a better securement device, which is this twist, basically this twist. So the G-tube will be just a nice twist into place. It makes everything last longer. It's a little easier, I think. So at some point, the G-tubes will be switching over to that. This manufacturer, this tubing's got ahead of it, and that they know that they can do both ways. So right now, we have the classic G-tube securement, which is this piece, and the new one, which is this piece. So at the moment, they have both bases covered. So what you're going to want to do, though, when you first receive this, you want to give this a little bit of a twist. It is already sort of tightened down, but you want to give it a little extra tighten, just to make sure, and I'm just tightening a little more to make sure there's no leakage through here, because this is another connection point, so you want to make sure this is nice and firmly secured so that there's no leakage while this is running. So I'm just going to, when I brand new, take it, tighten it down. That's a one-time deal. It's now tight going forward, so that's okay. So at this point, I'm going to set this to the side, and you'll want to keep that cap on there until we're actually ready to connect it to the patient, because we want to keep this nice and clean. So we can leave that cap on there until we do the priming. So I'm going to leave it on there for now. So let's look at, go ahead and let's look at filling the bag up. So for my demonstration here, I have a can of Pediasure, just one can. And see, with this 1,000 milliliter bag, we can fit several of these cans. The can's 237 milliliters, but I'm just gonna do one can for my demonstration. So I'm gonna go ahead and get this poured in there. So it says on there, shake well. Just a moment, I'm gonna give it a good shake. And then look at installing this, pouring this into the bag. So I'm gonna go ahead and pop this open like a can of Coke. All right, and currently, right now, there's a flow stop. This device right here is basically stopping any flow. So even if you were to pour the formula in with this not secured in the pump, this will still be stopping the flow. So you don't have to worry about any free flow. If you notice, there's no clamps on the line. There's no any sort of a clamping device. It's because this section right here has a free flow, has a flow stop happening. So right now there's no flow happening through the tubing. It is stopped up by this device right here. So we can go ahead and pour this in at any point. We could have this not in the pump while we pour it in. It doesn't matter. So I'm gonna just take it out of the pump really quick, and we'll reinstall that after we pour it in there. So I'm gonna pour it in there right now. So just like so. Let's try not to spill any. Alrighty then. And this is a lot for, or a little for how big the bag is, but we're just doing one. Okay, and I was out of view for a second. So now we can go ahead and put the lid on there. So the lid goes in here very easily. It just closes. You want to give it a nice little press. And what I'm going to do before that is I'm going to try to just prime a little bit of the air out of the bag before I close the lid. So if you see, I'm just pressing on the formula, forcing it out the bag, forcing any air out of the top of it. All the way up till I see kind of coming out of there, and that just helps remove any of the air out of the bag. That removes any issues that can occur as well. So go ahead and put this in here. So it just kind of pushes in, and I'm just trying not to spill, being nice and careful. So that pushes in there. It's got this little press here. So once you're in there, you give it some good secure presses. There's the press here, and that holds into place. Once you have that done, go ahead and do this little clip onto here, and that holds into place. And at this point, give it some good presses. It is now pretty much sealed. You're not going to get any leakage out of that lid. You can hold it upside down, and it's not going anywhere. Also, you can see we got most of the air out of the bag. If I hold it like this, there's just a couple little air bubbles, which that makes it just for less issues going forward. So I'm going to go ahead and set this over here. And let's go ahead and reload the tubing. So as you can see here, there was no flow happening. There's no flow happening. It's stopped right here. The flow is not going into the tubing at all. That flow stop is stopping it. So let's go ahead and reload this into the pump. Grab it from my little handle, slide it into place, pull it through the channel, around the wheel, and into position, and close that. All right, now let's take a look at the pump's programming. So I'm gonna go ahead and turn it on. And I did that by pressing the on button. I know it does not say on and off, but this is a power symbol that's traditionally meaning on and off. So here's how you turn the pump on and off, and I give it a little press and hold just for a moment. So for this pump, it's not programmed, and I have it not programmed because I want to go over the programming with you. With these pumps, the patients will want to know how to program them. The feed amount needs to be adjusted sometimes. The feed rate needs to be adjusted sometimes. So I want to show you how to program so you can show the patients how to program. So the first two things on here is prime pump or adjust feed. Adjust feed is program. So first we're going to program it and then we're going to prime it. So I'm going to go over this adjust feed and press this once. And you can see it's this arrow corresponds with the button. So this is the button for prime pump right now. This is the button for adjust feed. This is the button for more. So I'm clicking on adjust feed. And it's changing to our two values. We only have two values for this pump, feed rate and feed VTBD, which stands for volume to be delivered. So we have our rate and our volume. So I'm gonna go ahead and do the rate first. I'm gonna click on the top one for rate. And it has a little unique programming screen for this. So as I click on it, you'll see how it works. I'm gonna program this for 125. This arrow corresponds to this arrow, which corresponds to the 100th. So there's 1. This arrow corresponds to this line, which is 2. And this one corresponds to the last one, which is 5. 2, 4, 5. We've now programmed it. As you can see, it's kind of a unique little programming screen for that. So I'm going to do enter. And you can see here it changed on the right side. We now have 125 as your mLs per hour. So let's go ahead and program the feed volume. I'm going to call this volume going forward. So feed volume, clicking on that. And it's the same little screen here as you can see. So if this one we had max is 3,000, the bag can only hold 1,000. So the most we can usually do is 1,000. So we know that this can, if we take a look at this can, the can says 237 milliliters. And you can see that's right here, 237. So let's program this one for 237. So we got 2, 1, 2, 3, 1. And you basically will program this by how many cans and how much has been put into the bag. So we now program for 237. So I'm going to do enter. So we have down here at the bottom, here's our volume. 237 ml is our volume. The last thing on the screen that you're looking at that I haven't described is this is the amount that has been fed, 0 ml. So if you want to see how far you are in the feeding, it'll tell you right here. So if we were 5 milliliters in, it'll say 5. If we were 100, it'll say 100. This tells you how much you're in. This tells you the total. This is how much has been fed, which tells you how much is left. So at this point, I'm going to press done. If we were ready to run, we could run it, but I'm going to press done right now. So I'm going to go done. And that takes us right back to our prime pump and our adjust feed screen. And I want to prime the pump now. So what I'm going to do is I'm going to now get to this point, and we want to make sure we keep this nice and clean since this is going into the G-tube at this point. So I'm going to take this and I'm going to set this into a red cup that I have over here on the side so that I don't get anything on the floor. So that is now right there. And I'm going to go ahead and click on prime pump. So I'm clicking prime pump. This pump has a lovely auto prime feature. It basically knows exactly how much formula it takes to go through the tubing to prime it. So I'm going to do the auto prime feature for this. I'm going to get so you can see the tubing. And the other one is hold to prime. So we'll do a manual at the end, so we'll look at both of them. So first I'm going to do auto prime. So I'm clicking auto prime once. And then you'll see it flowing through the tubing here in a moment. There it goes. And you'll see it flowing through the tubing on the right-hand side as well. So you're basically just going to watch this, watch it for that end there, and you'll see what it's going to do once it gets there. I'm going to attempt fate and just try to hold it for the last second. Okay, great. So it stopped just a little short. So you do want to manual that last little bit. So I'm just getting a good view there. You can see there's that last little bit. So what we're going to do is we're going to hold prime to feed for the last little bit. And I'm now holding this off screen into something. So you want to do is maybe a trash can, anything, a sink for the last little bit. So I'm holding the prime. It's priming the last little bit. I got 1, 2, 3 drops. And it is now fully primed. So at this point, we can go ahead and hook up the patient. So I'm going to set the pump down, and I'm going to simulate getting the patient hooked up and get the patient hooked up. They're ready to go. All right, let's get back to the pump. So let's get out of this prime screen. So to get out of the prime screen, we have this done at the bottom. So I'm going to press done. So we now have the pump set for it's got its rate, it's got its volume, we'll be ready to run it. So for programming, it's very easy. Anything that needs to be changed, you go into here, adjust feed, and you adjust the 2 feeds. We can change the rate anytime, we can change the volume anytime. So I'm gonna go done, and let's go ahead and run it. So at this point, we're ready to run the pump. Let's start it. And you know it's running. It does a few different things. The left side screen has changed. You can see it only has KTO and hold. Basically, it's pausing the pump. On the right side has this little drip thing going down, drop, drop, drop. That's signifying that it's running. I can also, if I'm quiet for a minute, you can probably hear it running. There was a little wheezing noise. So important thing to note for this is if the patient needs to stop this pump at any time, if they need to pause it, take a shower, do whatever, they can stop it, they can turn it off. When they turn it back on, it's going to remember exactly where it was at, and it'll pick up right where it left off at. So as you can see here, once we pause it, it has a few different options. It has a clear volume, which is clearing out the volume to start the feeding over again. If you say, hey, I want to start my feeding over again right now. Adjust settings if you want to change those settings around. Resume in 1 minute, or run it again. Don't worry about history. So go ahead and run it again. All right, we're off and running. And what I want to do is I'm going to go ahead and pause it really quick, and I'm going to increase the rate so that we can look at an occlusion and see what that looks like. Say there's some blockage down the line. We want to go ahead and simulate that for you so you can see what that looks like. So I've increased my rate to the maximum rate, and what I'm also going to do is I'm also going to pinch the tubing. So let's just say the patient's line is occluded, or the tubing is pinched, and let's see what the pump is going to do. It's going to take a moment to register that. If there's blockage on the line, and you can see here, I'll just get some of you. I got it, pinched off basically. And just give it a moment. And it is definitely taking a moment, but we're just going to give it a second here. And I assure you, it'll start alarming. There we go. So as you can see, we now have a flow error alarm. So it is basically beeping us saying, hey, somewhere down the line there's a clog. I need you to figure out what's going wrong, fix that, and then I can get running again. So this is usually, I'm gonna go ahead and pause it so it stops beeping. I just wanted you to see what that alarm is. So let's do stop alarm. There we go. So basically, if there's an occlusion down the line, the tubing got pinched, the patient's G-tube is stopped up, whatever it is, this pump will say, hey, there's no flow going on, fix it. So I'm gonna go ahead and remove that issue. And then once the issue is removed, you can go ahead and try to do continue, and it will continue on at that point and say, all right, if there's no more flow, I'll keep running. So right now I'm looking at the end of my tubing and I'm seeing it flowing, so I know it's running again. And you can see here, it should have really gone up for 1 more milliliter fed for how long it was running there. So it even knew that, hey, there was nothing running. It just took a moment for it to get that alarm sequence to happen. The other alarm that it will have is that once the bag is empty, if I was to simulate basically, it pulling up air through here, it will start to alarm basically no food, which is basically saying that there's no food left in the line, of course. And that's a normal alarm that it gets when it's empty. If it ever, if it's programmed to give 500 milliliters and you only put 237 in the line, once it feeds all 237 and it senses that there's no more food going through the line, it will stop. It will stop no matter what. That's designed to not pump air in there. So once it reaches, once the sensor has reached that there's no more food, it'll stop pumping. So I'm not going to simulate that one because that's a normal one. The other one is, of course, when the feeding is complete, the feeding will be complete. It'll say feeding complete, and it will stop at the top of the screen and want to be reset and started again. So if it's getting the no food alarm, that's probably because you're getting some blockage. What can happen is if the bag ever gets reused, or if the can isn't shaken that well, you can get basically some chunks accumulating in this area right here. There's the feed error, perfect. So that's because I believe that I have basically created a vacuum seal. I'm gonna do stop alarm. I created a nice little vacuum seal right here. I'm gonna point to it right here on the tubing where it's actually the tubing meets the bag and it's pulling it out. There's a little bit of a vacuum seal going on because it's been trying to pull nothing through there because all the formula's up in the bag like that. So that's the feed error. So that's saying that your bag is empty, there's a clog in the line, your valve is not loaded. That's an issue between the bag and the pump, which is most likely going to be the cause of either being no food or something happening right here that's clogging it up, right here on this piece. It's hard to point and hold it, this piece. Okay, and then once you, of course, resolve that error, which if I hold it back up, put the formula back, and you do continue, it'll keep going. This one, it may alarm because I still have some bubbles in here, as you can see, getting there. At this point, what you would want to do is disconnect, prime, if this was the situation, prime it all the way out to the end, and then start it again. Okay. And the next thing I want to show you about this pump, I'm going to go ahead and pause it and turn it off. The next thing I want to show you this pump is it has a unique feature that only this feeding pump has, which is it's able to use a dual bag situation. And what that means is that basically it has on the same tubing, it has two bags, and I'm going to show you that in a moment. And let me get those bags set up. It'll be more clear as well as I get them set up. So let me uninstall this one and set this one to the side. Okay. And pull out this dual bag right here. So this is the dual bag, and what happens with the dual bag is it's designed to basically do feeding and flushings with the same bag. So you don't have to change the bag out, you don't have to swap the bag. One bag does flushing, the blue one does flushing, and the purple one does feeding. So basically what it'll do is it will feed for a set amount of time, and then it will stop and then do a flushing for a certain amount of time. And then once the feeding is ready again, it'll start feeding again and it'll do flushing. It does basically those back and forth. So this is one of the reasons that we have the Joey pump, is it does both of these feeding types. So what we're gonna do is we're gonna go ahead and install this into the pump. So the tubing is the same way right here, as you can see. It's got the little handle, same little handle. Slides into place the same way. Feed it through the wheel, around the wheel, into place. Go ahead and close it. And then when you install a dual flush bag into the pump, it actually knows and will change the screen and demand settings based off of this. So I'm going to do clear settings. Normally when you turn the pump back on, if it's pre-programmed, you can keep the old settings. That's useful if you want to keep using the old settings over and over, or you can clear them out and start over. Normally you want to keep the settings. That keeps in your rate and your volume, so you don't have to program it every time. But I'm going to clear it out for our demonstration right now. So I'm doing clear settings, and we can see right here it has a little bit different options. It has prime pump, adjust feed, and adjust flush. Flush is the new part. So on the right side here, we have a little bit different settings on here. Same milliliter per hour, same milliliter fled, but we have flushing. So we have flushing this much. Right now it's set to 0. We can set that to whatever we want, 100. And we can flush every so often. So we can set how many hours. Every 6 hours do a flushing. So that programming, let's just go through really quick and just adjust a rate. Let's do 125 again. Let's do a feed volume of 237 again. And let's look at a flushing, adjust flush. So let's do flush volume. Let's just say flush volume of 100. And let's do a flush interval of every 3 hours. So as you can see here now we've got them all inputted. We have a rate of 125, a volume of 237. It will flush 100 milliliters every 3 hours. So basically when I run this pump, it's going to do the regular feeding, and in 3 hours it'll stop the feeding on the formula and automatically switch to the flush and do a flushing, and then go back to feeding. So that's a nice little unique feature for the Joey pump. Next thing I want to go over, last thing I want to go over are the error codes. So this pump is equipped with several error codes. You saw the occlusion alarm or the upstream occlusion alarm. The last one it receives is an error code where it will say error, and it'll have 2 numbers. So it'll say error code 37. And actually on the screen as well, have a little person that will kind of have a little thought bubble that's kind of scratching his head and going, you need to contact the manufacturer at that point. So if you receive an error code 35, what that's saying is there's something going wrong internally in the pump. Maybe the motor's going out, the internal, one of the sensors is going out, but the pump's having an issue and it needs to come back to get serviced, and we need to send out a new pump. So those are error codes that usually can't be resolved. If you're having any error codes whatsoever, you should be instructed to contact the pharmacy to go over that, troubleshoot that. Some codes can be fixed in the home. They're just simple issues, but certain codes, the pump needs to come back, it needs to get serviced, and we need to send out a new pump. So we would like for us to determine when that happens, but if you see the error code 37, you know, oh, that's not good. I need to contact the pharmacy and get a new pump sent out right away. And you'll know that as well. It does say on the screen, please contact the manufacturer. Don't contact the manufacturer, contact us so we can send you out a new pump. We just need that information back to us. So when we do send it to the manufacturer, we know what went wrong with it. And that completes the training for the Kangaroo Joey pump. All right, thank you, and we'll see you for the next one. And I have one last additional piece of information to show you. I'm going to show you how to put this pump into the backpack. Whenever we send this pump out, we send a nice little convenient backpack with it so the patient can then take this pump around with them and go do whatever they want to do with it. So I'm going to go ahead and get this backpack out and show you how it goes installed into the pump. So here is the backpack. I'm going to pump it out of the way. This is the backpack. You can see on the back of it, it's got little straps for a little backpack. We have 2 sizes, a small and a large one. This is the small one for the 500 ml bag. We have a larger one that's much larger for the 1000, but it's a little big for fitting in my shot, so I'm going to use the 500 for this. It's going to kind of squeeze in there, but it's still the same thing. So go ahead and unzip the bag. It's got little zippers. Unzip it, and then hold it open. And inside the backpack, there's a little diagram right here that kind of shows you how it goes in there. So you can see here, it's got glitter going on, good old plastic. Shows you how to hook the bag into there and how to put the pump into there. So it's got a little diagram just for some reinforcement, but I'm going to show you how to use it right now. It'll make sense as I go along. So first part is to undo this little securement pouch. So this is where the pump goes. So you undo that Velcro, and the pump goes in here just like so. And you want to be careful that you don't pinch or kink any of the tubing as you're doing this. Just be careful of where everything's ending up at. So the pump then goes into here like so. Just working on getting in there. Okay, fantastic. Okay, pump goes in there like that. A little bit of, just kind of show you there. Pump is now secured in there. So go ahead and do this little Velcro strap to hold that on there. All right, the next part is the bag. So the bag portion goes over here. You can see on the top here, there is a little clip. This clip goes on the top of the bag. So this bag's a little big for this, so I'm gonna pretty much fold it in half for my demonstration, kind of scrunch it down in there. This would be what a 500 size would look like. The 1000 one's a little taller. So first part is this little piece clips onto here to hold this into place. Get that in view. So that clips onto here, just like so. The next part is, this is actually a little Velcro pouch right here that holds into place. So I'm going to go ahead and undo the Velcro pouch. This undoes, and this one, I'm going to keep it nice and kind of scrunched in there for you. So it's kind of holds in there just like so. And the Velcro pouch nestles it into place. So just kind of into here like so. And then it's holding that into place like that. So the bag's nice and held into place. At that point, we can go ahead and close it up. So you can see it is closing in there. Let's go ahead and zip this up. And there is a spot for the tubing to come through. So over here on this side of it, there's a little hole here. This is where your tubing would come through. to get the formula off my tubing end here. So pretty much what you're gonna do is you're gonna feed this through this little hole, just like so. So that comes out through that little hole there, so you can totally zip it up. And then this point, you just wanna make sure, as you can see here, the tubing is pretty free and clear. It's not having any issues, just like that. And then we can go ahead and zip it up. So I'm just going to not hit my camera. Go ahead and zip it up. There we go. And got a little taller now. You've got a nice little backpack that holds it into place. You got everything in there. You got the tubing and the pump in there. You can throw this on your back and carry it around and go wherever you need to go with that. And that is the additional information there. Last thing to show you is once you put the pump in there, you can take this, undo the Velcro, and it'll show you what's going on. So you can take a look at the pump while it's in the bag. You don't have to take it out. You can see where you're at on your feeding, what's going on, and all that information is right here still on the front of it. For nice, easy access, you just undo the Velcro front of it right there. And that's how we put it in that direction initially. Okay?